So how do you feel about going to the hospital if you don't necessarily have to go, but you probably should go? That's a big question right now as we talk about reopening the economy, getting things back open again. I'm pleased to be joined now by Carolyn Candiello. She's Vice President for Quality and Patient Safety at GBMC Healthcare System, and they've done a survey about where Marylanders are on this issue. Great to have you on the show. I appreciate you coming on the show.
Well, good morning, Brian. Thanks for having me.
Based on the results of your survey about going back to the hospital, about the doctor's office for, whether it's a regular procedure, if it's an operation, just to see your doctor, where are Marylanders when it comes to their concern about COVID?
Well, according to our survey, we wanted to see what our community was feeling about this because we had seen a decline in admissions throughout the whole heightened stage of the pandemic, and our survey said that about 52% of patients felt that they didn't feel very safe. And so we want to assure our community and to assure our friends and neighbors that, it is safe to come to the hospital during this time. We have taken utmost precautions. We've increased our cleaning procedures. All of our staff are screened every single day. We practice hand hygiene. We do all the things that are recommended by the CDC, including wearing masks ourselves. Patients coming in for surgery are screened. They're tested for COVID to make sure that they are safe for our care providers and safe for other patients.
So 52%, that's a pretty big number of people say they do not feel safe or too safe to go back to the hospital. So how do you convince them that it is safe to go back to the hospital?
It is a big number, and it is, I think one of the things that I emphasize for our community and for our patients is that it's less safe to stay home and suffer with symptoms. So if you're having a heart attack or you're having signs and symptoms of a heart attack, you want to be able to come to the hospital and feel comfortable doing so. And waiting could be more dangerous. Other things such as cancer screenings, mammograms, colonoscopies, prostate screenings. These are important treatments, tests to determine whether you might have an underlying health issue that is even more serious. So we want to assure people that we are here for them. GBMC has been here for over 50 years in the community. We understand infection prevention, and we understand how to do it well, and we are doing it well.
We're talking with Carolyn Candiello, who's a Vice President for Quality and Patient Safety at GBMC. One of the things that I've heard from people who are in healthcare is it necessarily that when the patients are there and they're in the room and they're actually being looked at by the doctor, it's the process of getting them into the building and the waiting room as well, because, those things can back up. What are you doing at GBMC, or what are hospitals doing to try and prevent that kind of gridlock?
Sure. Well, we haven't actually experienced any gridlock. Our patients do come in. We have screening stations where their temperature is taken. They're asked a few screening questions, and they will then go into their provider's office. And we haven't actually seen a backup. It's actually run very smoothly. For patients who are coming in for scheduled surgeries, we have an excellent process in place where, in addition to their usual pre-surgical testing for H&Ps and EKGs and so forth, we're also doing the COVID testing, so they know up front whether they have any signs or symptoms of COVID.
All right. A couple of things regarding the numbers, and you talked about how you're worried about people not coming in if they've got signs of something seriously going wrong. There was a report out that maybe 15,000 people have died prematurely of Alzheimer's because of the pandemic. Do you have an idea of what impact it has had with people not going to the hospital, not getting the regular visits, not getting cancer screenings? Do we have an idea of what impact that has had on the healthcare system?
A great question, Brian, and I think it is a little too early to tell on that. We did see a decline in admissions. We did see a decline in emergency department visits, and frankly, we were worried about that. And, some of the patients we are seeing come in now, or in the first few weeks of when we began seeing things lift a little bit in Maryland, we were seeing patients who had waited a little bit too long, and they're sicker and require much more resources. So we want to encourage you, if you feel like you need to go to the emergency room, don't hesitate because of fears of COVID. It's really important to get that care and treatment early on. If you're having chest pain, come to the emergency room. Call your provider if you have questions. These are simple things that we want to make sure our community understands that we are still here for you.
Elective surgeries as well.
Absolutely.
Right.
Elective surgeries as well. And, these are things that, such as a knee replacement or hip replacement, things that you may have put off during those first few days of first few weeks of phase one. But these are things that are safe to be done now. We're following guidance from the CDC, and we are feeling that it's very safe, as well as, all the other hospitals in the Baltimore area.
Very good. Carolyn, great to have you on. Thanks very much for coming on the show.
Thank you so much, Brian.
Carolyn Candiello, who's a vice president for quality and patient safety at GBMC Health System, and they did this survey about how people feel, and more than 50% say they still do not feel too safe or safe at all on going back to the hospital. There's another, just about half. It's like split half and half on that aspect of it. And that's the big thing, is how safe do you feel going out to the stores? And, slowly but surely that was getting better. I do wonder what impact what we are seeing in Texas and California and Florida and Arizona is going to have on the psyche of Marylanders and people in the Mid-Atlantic region. We'll get to schools, and a fascinating conversation I had with a doctor from Harvard earlier in the show in the 6 o'clock hour about what he said schools really need to do to get kids back in. And it's pretty simple, and it makes a lot of sense, but will it happen? That's on the way next, 8:14 on WBAL.